Thank you. All righty. Good afternoon. I hope everyone enjoyed a safe and healthy and thankful Thanksgiving. We certainly did in our family. Today we're making progress in the fight against the COVID pandemic. We're coming much closer to the distribution of a COVID vaccine. That's tremendous news. We were on a call this morning with Vice President Pence talking about the arrival of the vaccine, which appears relatively imminent. It appears that in mid-December, some of the first shipments may be available. This is great news. We are very appreciative of the brilliant people who have developed what appears to be effective vaccines. But we have to make sure they're available to folks. And I'm making a request today that our clinics and our pharmacies and our hospitals, our physicians, will sign up and enroll as providers for the vaccine. This is very important because we have to have people enroll in the program to become vaccine providers, to actually administer the vaccine. And we've had a lot of people sign up, but we need a lot more providers to, in fact, enroll in the program. So I'm asking people to do that at the right moment. You can register through the State Department of Health. That's www.covidvaccinewa.org. And if you're enrolled by December 6th, you could be eligible to receive the very first shipments of the vaccines. Now, of course, there'll be fairly relatively limited numbers available in the first few weeks of this matter. But again, I hope that anyone in the medical profession, the pharmacy industry, can sign up and enroll to be a vaccine provider. We'd like to get as close to universal coverage as we can, and your help could be really, really great. So today we got a really exciting announcement of having a new tool in our toolbox to fight this pandemic. We now have a tool that we're going to be making available to Washingtonians to make sure that you know if you've been close to someone who's positive with the virus. So this is a tool that when you're out and about and you use your cell phone can effectively alert you if you've been in close proximity with someone who's tested positive. Our office has partnered with the Department of Health, Google, and Apple on this feature, and it was developed with incredible leadership from the University of Washington. This feature, we're calling it WA Notify, and it's particularly innovative because it will alert people without ever having to share personal information, and this is the beauty of it. This is a program that will alert you if you've come in close proximity to somebody who's positive without ever having to share your personal private information. Phones with WA Notify share a random code using Bluetooth technology, making it possible to alert people without sharing personal information. And it doesn't even need to know where you are for the system to work. So I'll talk a little bit more detail about this, but I think it's important maybe at the beginning to talk about what this program does not do, because it's important for people to have confidence in this system. First off, this system does not store any personal information. Second, it does not share any personal information. Third, it does not track your location. It doesn't know where you are. It won't store that information. It does not track which WA Notify users are notified if you test positive. And last, it doesn't provide any personal information to developers or to the Department of Health. So let's just talk about how this works. Let's say you're out in public and you spent time near someone who at some point is positive for the virus. When two people using WA Notify are near each other, their phones exchange random codes using Bluetooth technology. That means this is anonymous, and it does not involve location tracking. If one of those people later tests positive for COVID-19 and they enter a verification code from public health officers into WA Notify, anyone with WA Notify who was near that person during their infectious period will get a notification they may have exposed to COVID-19. Notifications contain links to information about what to do next to protect yourself or others, and they don't contain any information about who tested positive or where your exposure may have occurred. This allows more people to get the testing and care they need quickly. And all you need to do it is to activate this feature, this exposure feature in your settings feature on your Apple product, or download it as an app on other smartphone models. You can go to wanotify.org to find out everything on how to activate this feature. Another important point of this is a voluntary system. No one has to do this. It's your choice whether to enable it or download it on your phone. But obviously, the more people who take advantage of this, the more who will know whether they've potentially been exposed to COVID-19. And I'm very pleased to say that as of the last couple of hours, we've already had over 200,000 Washingtonians enrolled in this program. We're releasing WaNotify in 29 languages. It uses an algorithm that determines how close users were for how long and puts it in the context of the COVID-infected person's contagious period. That means if you were on the other side of a grocery store from someone who tested positive and has the app, it doesn't trigger the exposure notification. The algorithm uses the CDC's definition of a close contact. It's in about 6 feet for 15 minutes or more to decide whether to alert you or not. Your proximity to someone infected with COVID is determined by the strength of the Bluetooth signal between smartphones with WaNotify. Data suggests, models suggest that even a small number of people who use WaNotify in King, Pierce, and Snohomish counties alone would reduce infections by up to 11% and deaths by up to 15%. Now, just a moment why we're doing this. Maybe it's obvious, but we think an exposure notification tool that preserves our privacy is a great complement to traditional contact tracing. But exposure notification is something very different. The app does not track or trace information about who you are in contact with or where you came in contact with the other individual. That information remains anonymous. The state chose to pursue this technology after we convened an oversight group of security and civil liberties experts and community members to review the program with Apple and Google. Other states have already seen decent participation, including Colorado, Maryland, Connecticut, and the District of Columbia. Now, it's also important to understand this is not a fail-safe for whether or not you've been exposed to COVID-19. But WaNotify is one more tool for awareness and care that we did not have before in our fight against this virus. This seems to be a very elegant and important tool in a fight against a potentially fatal disease. We recommend it. We're very happy people are already responding well to it. And we're going to look forward to more having access to this feature. Now, this was, WaNotify was created in part from help from the University of Washington. And to talk more about this and why students should take advantage of this app, we're joined by University President Anamari Kase. Madam President.
Inslee, we're really proud to have been part of the development of the statewide program. It was a truly multidisciplinary effort, and the University of Washington brought together experts from across all the university to help the state reach this milestone. We had people from the School of Public Health, from medicine, from nursing, and from the Brodmann Beatty Institute playing key roles, as well as researchers in UW's Paul G. Allen School of Computer Science and Engineering, who did the early development work on what has now become the statewide platform. And a very special thanks to Janet Baseman, the Associate Dean in our School of Public Health, for her leadership of the state's advisory committee, which Governor Inslee talked about. This committee included experts in public health, in ethics, in healthcare, in privacy, security, as well as representatives from community advocacy organizations to ensure that this technology would be effective and safe and private. Privacy is absolutely paramount, and the goal from the very start was to use this technology to help to minimize the spread of COVID-19 while protecting users' privacy. The platform does not collect anyone's information, and it's completely voluntary. The University of Washington has also helped to build confidence in the program because we conducted a soft launch of this program right at the University of Washington on our Seattle campus. And so we were able to use it both to test privacy and to work out the technical issues. We like to say that the University of Washington is actually the University for Washington. And this program is a case study of how we try to live up to that promise. The work we do has impact on people and communities across Washington, and that public service is core to our mission. Our UW experts will continue to collaborate with Washington's Department of Health to evaluate how WA Notify technology works. This includes evaluating its benefits to users and to public health, and we look forward to continued progress and development of this very important and timely tool. Thank you, Governor Inslee. We love working together.
Thank you for your leadership. This has been an important tool, and it's just so great to have such a great research institution, which yet again is helping Washingtonians in their daily lives. And we've got another great research institution, Washington State University, doing some good research too. So we're very fortunate in the state of Washington. So thank you. We'll look forward to your further work on this. On another subject involving our economic development plans, the Department of Commerce is on track to open applications early this week for the $50 million in new Working Washington grants. And we'll need everyone's help spreading that word. So if you know of a small business that has been heavily impacted by COVID, a restaurant, your favorite music venue, your local bowling alley, please tell them to visit commerce.wa.gov/bizgrants and stay connected to the Department of Commerce so they can apply as soon as possible. We hope that this is going to help. Our vigorous discussions are continuing about future economic plans with legislators and others. We're going to keep working with legislators. We've had some good discussions in the last few days, and we hope we'll have more good news to announce. So we have John Weisman available to answer questions as well. So for that, happy to stand for questions.
All right. Up first, we'll go to Rachel LaCourte with AP. Go ahead, Rachel.
Governor, speaking of the Commerce grants, has any decision been made on how the remaining $150 million in CARES money will be used by the end of the year?
Not final decisions, but as I've indicated, we are having some what I consider very promising discussions with legislators and parts of industry about those subjects. So we hope to have more to say in the near future, in the next few days.
Rachel, did you want to ask a follow-up question?
Yeah, on a separate topic, the House Public Safety Committee is holding a hearing today where lawmakers are talking about several police reforms they'd like to adopt, including making it easier for the Criminal Justice Training Commission to decertify officers for misconduct and creating a statewide agency to investigate and prosecute police use of force cases. Where do you stand on these measures, and are there police reforms that you would like prioritized in the upcoming session?
Well, yes, we will be introducing legislation to assure the independence of investigation and the independence of prosecutorial decisions. We're in the final stages of putting those packages together. As you know, our task force has made some specific proposals, so we're ironing those out right now. I haven't looked at the things you referred to, so I can't really comment on them, but I don't believe the two things that I've referenced will be the exclusive discussion coming up in the legislative session. I believe there will be more work.
All right. Up next, we'll go to Joe Sullivan with the Seattle Times. Go ahead, Joe.
Yeah, question for Secretary Weissman. Now that Thanksgiving holiday weekend is over, what's your understanding of how many people were traveling in Washington through various methods, and what we can expect to see in cases in the coming 2 weeks here?
Great, thanks for that question. I don't have the number of folks who were actually traveling. As the governor's pointed out before, we do know from some surveys about what people intended to do that Washington was in the top number one about staying home for Thanksgiving and not sort of inviting others over for social gatherings. So we're real pleased about that. But we're watching the data very carefully in terms of what we might be seeing in terms of a spike or continuing to level off or even go downward. That's going to take us like 10 days or so after Thanksgiving to start seeing those signals in our data. Because you'll remember it can take 5 to 6 days or so to develop symptoms. Folks get tested, get their results. So we're watching these data very carefully. We're still very concerned. Hospitalizations continue to increase, which is concerning for us. And we just need everybody continuing to really pay close attention to their wearing their face coverings, keeping their distance, not having social gatherings, and doing good hygiene so that we can all see these numbers come down, which is what we're looking forward to having happen.
Joe, did you want to ask a follow-up question?
Yes, for the governor, how many people do you need to sign up for this app to make it considered measurably effective?
Well, I think 2 is the answer, because if those 2 people get within close proximity, one life could be saved or more. So I don't think there's a minimum threshold. All we can say is the more people, the more lives we will save. And again, we have over 200,000 people have signed up, so it appears to be a very popular tool at the moment. I hope that will grow. John, do you have anything to add to that?
Modeling studies that have been done looking at King, Pierce, and Snohomish counties, the modeling studies suggest that if 15% of the users, those folks with smartphones actually use these, that we could see infections decrease by 11% and deaths by 15%. So we're really encouraging everybody to give serious thought to activating WA Notify and have another layer of protection as we go forward in trying to end this pandemic here in Washington.
You don't get something that's free, private, easy to use, and effective that can actually save lives, maybe your own, or more importantly, even maybe your loved ones. So this is a pretty sweet deal for folks. They can decide what to do with the information, but at least they'll have information at their disposal.
All right, up next we'll go to Lindsay Sheldon with Cairo. Go ahead, Lindsay.
There, Governor. My first question is in regards to the CDC considering reducing the recommended quarantine period from 14 days to 7 to 10 days with a negative test result at the end. Is that something that you, Governor, or Secretary Weissman would consider?
John, you want to handle that?
Yeah, yep, we know that CDC is actively looking at that, and we are engaged in that as well, working with our epidemiologists, et cetera. Based on their recommendations, I would suspect that we would follow those, but we are carefully watching that and engaging in the conversation.
Lindsay, did you want to ask a follow-up question?
Just a follow-up to that, thank you. Given that positive test prevalence is getting close to 10% overall, which makes it tough to save time supplies with pool testing, and given that new quarantine time would require that test at the end of the 7 to 10 days, I'm curious where our state stands in terms of testing capabilities and supplies necessary to deal with this current surge, possibly another increase ahead, and then those additional tests if we do move to that new kind of guidance.
John, you want to talk about tests?
Yeah, absolutely. We continue to increase capacity across the state. A number of local communities are increasing the number of their community test sites. We continue to look at partnerships with pharmacies and others to offer the test. We also know that the federal government is approving more and more testing methodologies, including the first test that was approved, I think, a week or so ago for in-home testing, where one doesn't even need to send a sample to a laboratory. So we expect more and more testing options available for folks, which is a good thing.
Yeah, I think you can look forward to that continuing in the weeks and months to come, that capacity will continue to ramp up, particularly the antigen tests coming on. So we feel good about that.
All right. Up next, we'll go to Jim Kennedy with the spokesman review. Go ahead, Jim.
Thank you. I'm wondering, what is the recommendation that you have for someone who's on WA Notify, gets a notification they've been in close contact with a person who has tested positive, and should they go get tested? Should they self-quarantine? What do you do with that information?
Well, they'll get a recommendation from the Department of Health. It will be up to them whether to follow it, but they will get specific recommendations in response to that. And that'll be done on an anonymous basis. Other people will not know they've been notified. And I believe they will find it quite clear. John, you want to add to that?
Yeah, so you're right. The app will anonymously notify you that you've been in contact with someone. It will have instructions on it on what to do. And those instructions will include certainly self-quarantining if you develop symptoms, to immediately get a test, and if you develop symptoms, to immediately isolate yourself. And so the important thing will be that message is sent out by public health and approved by us, is to follow those instructions.
I want to reiterate, though, those are recommendations. They're not legal requirements from the Department of Health or the state of Washington. They are advisory, so that if you use this app, which is, again, up to you, if you do use it, when you get the information, when you get the advice, it'll be your personal decision about how to handle that. Of course, I would recommend following the Department of Health, because we got a really good one here, but it will remain an individual decision.
Jim, did you want to ask a follow-up question?
Yes, on vaccines, is the state still planning to do a review of the data on the vaccines? And if so, what kind of a delay, if any, do you think that will create for distributing the vaccines?
Yes, and negligible, hours probably, we hope. And I will, if I can comment on this, I continue to have higher and higher degree of confidence in this whole process. We had a thorough rundown of the process this morning on the call in the Vice President's office, and I see nothing that causes me concern about the process that's being followed. Now, that's a really good sign, because, as you know, I have been very willing, when circumstances required, to be critical of the current administration. But at the moment, it appears that the medical community has been successful, frankly, keeping what will soon be the former president's hands off of this process. They're doing it according to Hoyle, according to the rules, according to the science. And from what I've seen so far, I have a very high confidence that this process will be seen as extremely credible. And that's really good news. This has been a huge success, where the regulatory health folks have been courageous in standing by the standards that they expect to have to assure safety and efficacy of the vaccine. This is really good news. They've won this battle, but we will have a look-see with our local folks. John, you want to add anything?
I would just agree with that. Everything we're seeing here at the Department of Health is reassuring, and they are clearly taking the time to evaluate the data. We're looking forward to those public meetings where the scientists discuss what the data are showing, and we have some of our own folks who are engaged either in review of those through the CDC, through this partnership with the Western states that the governor referenced. So we're feeling very good about the process.
Basically, people in the medical and health community have stood up They have stood up for science and our health, and I thank them for that. It's taken some courage to do it. Some people in the administration have been fired when they have done that, but these folks have stood stalwart, and I appreciate that courage.
All right. Up next, we'll go to Chris Daniels with King 5. Go ahead, Chris.
Yeah, it's a nice segue to, I just wanted to follow up on the term, the process, and how all of this is going to work. Governor, you had talked about getting pharmacists and others to sign up for the distribution of all this. Can either you or Secretary Weisman kind of walk us through how this is going to work? How quickly will people see these vaccines that look like they're close to government approval next month?
You want to take that, John?
Sure. So as the governor said, we're enrolling providers right now so that when the vaccine is shipped, that we are ready to have it shipped to individual providers to start vaccinating folks as soon as it arrives and as soon as all the clearances are given for that. So as the governor also said, initial supplies will be limited, and so we'll be continuing to finalize the final priorities of those. The Advisory Committee to Immunization Practices at CDC continues to also look at those final prioritizations, and we're waiting for that. So once we have providers enrolled, we will be actually telling the federal government where to ship vaccine to exactly which providers, and the federal government then either through the pharmaceutical company in one case or distributors in another will be directly delivering that vaccine to the locations that we indicate. And providers will be reporting on how much vaccine they're giving each day, what their supplies are, and then we will be putting in orders for additional vaccine for providers as they need it and as the vaccine is available. So that's a quick overview of the process.
If I can add a couple things, I hope people realize. Number one, in the month of December, there's going to be a prioritization, obviously, with limited supplies. In the month of December, folks in the medical community who do intubations and the like, who are exposed to the virus, going to be high priority. Folks in long-term care facilities that have comorbidities and the like, high priorities. But there will be a relatively limited number of folks in the first month. And that's important for a couple reasons. One, obviously, we're all going to have some need for patients here. That's pretty clear. But it's also really important to realize that it would be such a tragedy if the nearness to having a vaccine convinced us to give up on this effort we're all making to stay safe by socially distancing and not getting involved in gatherings in our homes, et cetera. We would really hate to lose lives when we're getting this close to the vaccine. So this is not the moment to reduce our efforts. I would argue it's a time to perhaps increase our efforts as we're getting close to being able to have a vaccine for folks. So the need to reduce our gatherings in our homes, to not have people breathing on us in our homes or not in our household and social gatherings and the like, that is still so important. And it's really great news to have the vaccine on the way. But if we're going to make the vaccine work, you got to be alive by the time you get it. So we really hope people will continue what has been a very vigilant, resolute effort in Washington so far.
Chris, did you want to ask a follow-up question?
Yeah, Governor, since you just talked about how close we are to a vaccine and not changing behaviors, we've seen some news out of California, Santa Clara County, Los Angeles County, and lockdowns and changing the methods for sports franchises and sports teams. Do you anticipate making any changes in the regulations for our local universities, including the University of Washington, or our sports franchises, for how they can operate and practice?
We don't have anything imminent to announce in that regard. All I can tell you is that the more that we avoid infecting each other in our homes and other places, indoors, not wearing masks, socializing, the more we can reduce those activities, the less likely it will be we would have to make any additional restrictions. That's the one thing I can say. So if we want the Cougars and the Huskies playing, we got to be careful. And that's the one thing I can say.
All right. Up next, we'll go to Keith Eldridge from Como TV. Go ahead, Keith.
Governor, in that vein, we're halfway through the 14-day period, 4-week period. Is there any indication that we should be prepared that you're going to go past December 14th with these restrictions? And is there a possibility, like Los Angeles, that we're going to need a lockdown on through Christmas and New Year's?
As I've said now about 4,000 times, I cannot answer that question. It depends on the course of the pandemic. And if it continues to expand at exponential rates, of course additional measures may be required. It's always been the case in the pandemic. And as you know, we have been extremely concerned about the exponential growth of the pandemic. There is no imminent decisions in that regard, nor could we make them today. But what we do know, if we want to avoid those restrictions, the best way to do that is for all of us to buckle down and avoid these social interactions with one another. That is a considerable reason for this risk. That's the thing I can share with you today. It's the most complete, comprehensive, honest, and important advice I can give to Washingtonians. Let's not have to consider doing those things. It's too painful.
Keith, did you want to ask a follow-up question?
For Secretary Weisman, on the risk assessment dashboard, when you look at disease activity and number of cases, we see the numbers going up and up and up, but there's a gray area where all of a sudden the numbers start to turn back down. Is there the potential that we're going to reach a peak and finally come back down?
Well, thanks for that question. That gray area is indeed an area where data are not yet complete, since we do those based on date of symptoms, onset. That is data that usually ends up adding more cases than what you see there over time. But we're watching these very closely. We've been having over 2,000 new reports each day with folks who have been diagnosed with COVID. The challenge right now is during the holidays and testing periods and when people go get tested, those patterns can sometimes change. So we're watching very closely what's going to happen over the next few days as we get past the Thanksgiving holiday and perhaps more people end up getting tested, what those numbers look like. So at this point, it's too early to call where we are, and we're going to be watching these very carefully. And then, as I said earlier, if there is some kind of spike that was associated with Thanksgiving, it's probably about 10 days to 2 weeks before we would really start seeing that in our numbers. So as the governor said many times, we look at these numbers every single day and try and track where this is going.
I'm glad you asked that question, because in almost every single graph through the entire pandemic, that's what shows on the graph. It is not a good sign. It's just simply that the data is not complete today. So on almost every single graph you'll see, it'll look like it's going down with the gray line, but that is essentially meaningless.
All right, up next, we'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
Right. Governor, you mentioned that 200,000 people are already using Law Notify, so clearly the number of downloads, or I guess in the case of iPhones, its activations, are being tracked. To what extent will metrics of participation be tracked? For instance, will we be able to know the percentage of people who get a code from public health who then actually enter it?
I don't know. John, will that be public or not?
So at the moment, that is not information that we obtain, and Apple and Google are looking at analytics and looking to develop those over time. They're not currently in use in terms of how many folks actually did exchange, random codes or how many folks actually got notified. So right now, those analytics are not a part of that. They're looking at developing those, and maybe those will be available in mid-December. And again, people, I believe, will be able to opt in or opt out of those if they want to participate. But again, no information is exchanged even then that identifies individuals or that identifies a location.
Sarah, did you want to ask a follow-up?
Yes, so the app is available in multiple languages. Are there any outreach efforts underway specifically to communities that have been disproportionately impacted to make sure this is also culturally relevant? For instance, I'm thinking of people who may be undocumented and could be hesitant to turn on or download something like this.
Well, we're going to do it in multiple languages, and we are saying this to everyone. This is anonymous. Data is not stored, it is not kept, the personal information is not recorded, neither are the locations recorded, and that's important to realize. You won't be told where this proximity occurred. So nobody is recording information where either one of these phones were at any time, nor are they recording the identity of those phones. So for whatever purpose you would want to assure your anonymity, they will be fulfilled. And frankly, that's the elegance of this program, to maintain anonymity and privacy and yet save your life. We think that's good for all folks.
I would just add that the information is being on how to enroll is being translated into those not only 29 languages that are available on the phone, but another 7 additional languages which smartphones aren't accommodating. But if somebody is more comfortable sort of reading in their first language, that information is available to them. So outreach is happening all across the state with various groups. And we had this advisory committee which took a look at it, which included people from disproportionately affected populations who really recommended that we should go with this and are sort of endorsing this approach.
All right, up next, we'll go to Tom Bancy with the Northwest News Network. Go ahead, Tom.
Hi, a question for Secretary Weissman. I wonder if you could elaborate a little bit more on the relationship between this notification app and traditional contact tracing in terms of, I'm kind of curious, having heard that a few counties at least are being overwhelmed with new cases in terms of doing complete contact tracing. Does this take any burden off the traditional contact tracers?
Well, thanks for that question. First of all, as we've said, we are expanding the number of case and contact investigators that we have. And indeed, using this kind of technology will allow us to go further and faster with this approach. So once somebody tests positive and a case investigator reaches out to them to talk to them about their positive test, they'll be asked if they use WA Notify. If they use WA Notify, we'll be able to give them a verification code that they can choose or not to choose to put into their app. And then that will allow others who have been in contact with them during a time of concern to be notified that they have been exposed to someone again, as the governor said, without any indication of who that was or where they were exposed. This really has a great advantage and supplements the case and contact investigation really nicely. Some people don't know who they've been in contact with. Imagine, for example, riding on a bus. Hopefully you're wearing your face covering and trying to keep your best distance, but you don't know who those people are. And so you couldn't even tell a case and contact investigator who might have been exposed. So this really allows for that to happen, and it allows people to be notified very quickly. So we see it as a nice complement to the traditional work that we're doing in case and contact investigations, and another tool to help us do our work.
Yeah, by the way, this is a substantial increase. We are engaging 350 additional contact tracers, so that capacity is increasing quite significantly. I want to reiterate too, when a person is approached by a contact tracer, they're given the information about if they want to provide this information, but it is, again, voluntary. They will not be required to do that by the contact tracer or the state or Department of Health. It will always remain voluntary.
All right, Tom, did you want to ask a follow-up?
Just a quick follow-up on the subject of the study from King Pierce in Snohomish County that Secretary Weisman mentioned. Can you tell us a little more about that? Was that on behalf of the State Health Department, or has it been published? Just a little more info.
Yeah, it was a modeling study done by Oxford, Stanford, and Google, who were looking at what it takes for these apps to have an impact. I don't have the actual reference right with me, but we can certainly make sure that you get it.
All right, up next, we'll go to Jay Cornfield with the Everett Herald. Go ahead, Jay.
Yeah, just picking up where Tom left off, there was a question about the modeling, and you did have a link to the abstract. So Secretary Weisman, maybe you could try to answer this. In the abstract, it says a model in which 15% of the population participated would reduce infections by 8% and deaths by 6%. But earlier you and the governor had said it was 11% and 15%. Can you explain the difference?
I don't have it in front of me. The information I have is as what the governor said. So I will follow up on that and see what the discrepancy might be in that, what you're seeing.
Jerry, I think that it was just a coincidence. I think what it shows, if 15% of people use it, it would reduce infections by 11% and deaths by 15%. So I'll have John confirm that.
All right, did you want to ask a follow-up, Jay?
If I could, a quick one. The readout this morning indicates the state has until Friday to identify physical locations for the Pfizer vaccine to be delivered to the state. Do you know, or were you looking at just coming into SeaTac? Is that the physical location, or would it be somewhere else?
The vaccine, we will indicate which providers that it should be delivered to, and it will be delivered directly to those providers by the pharmaceutical company delivery approach.
All right, up next, we will go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, this is going to be for Secretary Weisman. I'm looking at the latest contact tracing report from the 25th, and if you look at the 90% goal of reaching people within 1 day of a positive report, it steadily goes down to 6%. I'm wondering if that number is accurate for the week of November 8th through 14th, and if so, how concerning that might be about limiting the spread.
Right, so part of I have not actually looked at the report yet myself. The challenges that we've been receiving certainly are within that 24-hour report of being able to actually contact folks. This is the piece where we need folks who are willing to answer phones and be able to return our calls. We continue to work, as the governor said, in hiring folks. I know that some of our local health departments are also feeling the strains of this and continue to do our best to get a hold of people as quickly as we can once we get those results.
Anna, did you want to ask a follow-up question?
Quick one for Governor Inslee. I'm wondering if you wanted to offer any thoughts regarding the report over the weekend about a memo sent from the state auditor to ESD Commissioner Levine regarding roadblocks, warning about getting in the way of some of the audits going on related to unemployment.
Yeah, I think there was some disagreement between the two agencies about how to share information, how to get it in a timely fashion. And our office went to work on that, and that's now been straightened out. I talked to Pat McCarthy 5 or 6 days ago. It looks like we're in good shape. The audit is moving forward appropriately. Those troubled waters are behind us, and I'm looking forward to a good audit because that'll be useful to everyone.
All right. Up next, we'll go to Daniel Walters with the Inlander. Go ahead, Daniel.
Yeah. How long does the if you test positive, does the Want Notify app continue to alert people you come into contact with, or does it stop, or does it just alert people who tested positive in the just alert people who you've been in contact with the previous 14 days?
Right. So the algorithm will take into consideration both time and distance, and then when somebody was likely to be infected, and will just notify essentially folks from that time of now to past whenever that infectious period was.
All right. Daniel, did you want to ask a follow-up question?
Yeah, sorry, I'm not phrasing it correctly. If you're say you test positive and you continue to be in contact with people, does the Want Notify app alert those people after you've tested positive and entered in your information?
That's a great question. I'm not sure I actually know the answer to that. I have some folks who are listening in, and if they can text me the answer, we'll get that to you during this. Otherwise, we'll follow up with you afterwards.
Up next, we will go to Neil Fisher with Cap KView. Go ahead, Neil.
My question was answered. Thank you.
All right. Then we will go to Alex Crescenti with KXLY. Go ahead, Alex.
Yeah, Governor, how worried are you that with the Thanksgiving holiday and so many people traveling in and out of the region and in the surrounding states, how worried are you that we could see a surge in the next couple of weeks when the first vaccines will be administered?
Well, I was concerned enough to spend every single ounce of creativity, innovation, and perseverance that I could possibly muster for the weeks heading to Thanksgiving to try to save some lives, and I hope that it has. I think there is some good news that we have had an impact. As John indicated, we appear to be the #1 state in the United States to act safely during Thanksgiving. But, you know, we know it wasn't 100%, so to that extent, we are concerned. I do want to reiterate, and I'm sorry if I repeated myself, but it's not just Thanksgiving. In the weeks to come, and indeed in the months to come, until we have broad-scale vaccine, it is just as imperative to avoid, a celebration of a football game with a bunch of folks sitting around close to each other, not in the same household, not wearing masks. That is just as dangerous as a Thanksgiving dinner. And so, you know, you might think of Thanksgiving as the kickoff to this season of survival, and that's what's at stake here in the next several months. So I will continue to share this information with Washingtonians, and the more folks that join us in this effort, the better off we'll be.
Alex, did you want to ask a follow-up question?
Yeah, to Secretary Wiseman. When are we going to have an idea of if the vaccine is going to be successful? What is there going to be some sort of a timetable of, 2 months, 3 months that you can be like, okay, now it's starting to work here in the state?
Well, I'm not exactly sure what you mean by successful, but based on the studies that have been done on the clinical trials, we should know the effectiveness of the vaccine. And again, that we're hearing reports that it's about 95% or so effective. So we would expect that to be, the case. The point at which we need somewhere between 60 and 70% of the population probably vaccinated to stop sort of these outbreaks and ongoing transmission. So in the ideal world, that's what we're looking to have happen over time, is to get that many people vaccinated so that we can stop the transmission. And that's on the previous question. My experts are telling me that it basically does stop sending notifications once you're identified as positive, and if they're found to still be sort of not isolating themselves, and we learn that and they're cooperative, we can give them another verification code that could then notify others. But again, we're asking people, if they're positive, to isolate themselves at home and not put others at risk.
If I can share something relevant to that, it would be really wonderful if I could share information that, at the end of this year, we're going to have enough people vaccinated that we can go back to pre-COVID social behavior. I cannot say that. It will be months until enough people are vaccinated to essentially break the chain of transmission. And so we are going to have to hunker down while this vaccine increases the percentage of people who are vaccinated. So that's why this message we will be sharing, it won't finish at the end of this year. We will still have the need to save thousands of lives. And by the way, I have to push back. I've heard some people, some in the other party, that says we're just going to depend on herd immunity at this point. Herd immunity means tens of thousands or more deaths in the United States and hundreds or thousands in our state. Because during the months while we're waiting for this vaccine to get a highest percentage to break the chain of transmission, it would mean many, many more deceased people in our state and our country. That is a surefire disaster in the making. So that siren song is very dangerous, and we cannot allow ourselves to go on the rocks of herd immunity with the consequent deaths in our state, and we're not going to allow that.
All right. Up next, we'll go to Carolyn Bick with the South Seattle Emerald. Go ahead, Carolyn.
Hi, yes. This is a question for either the governor or Secretary Wiesman. Given that Moderna just filed for an EUA from the FDA, does Washington State have any plans in place to secure doses of that vaccine in addition to the Pfizer one?
Yes, we will have essentially the same process for that vaccine, and it could be maybe a week or 2 weeks after the Pfizer. But that seems to be on a good progress as well. And the distribution system will be relatively the same. Some distribution changes, as you know, regarding the cold storage that's required, but otherwise quite similar.
Right, and Washington State will be getting, its share of allocation of these vaccines. They're basically basing it on population size. And so we'll be receiving both of those vaccines.
Carolyn, did you want to ask a follow-up question?
Yeah, that'd be great. Thank you. Just to follow up on what you just said, Secretary Wiesman, so how much vaccine, I suppose, in total, when you combine Pfizer and Moderna's vaccines, will we initially be getting? And then how many continuing shipments will we be getting, in early January?
So we don't have those numbers yet on the Moderna vaccine. We are anticipating for the Pfizer vaccine to receive by the end of December around 200,000 doses, but we don't yet have the Moderna or other sort of estimates for the Pfizer vaccine, what will come in sequence. So we're waiting for those numbers.
I think we've got time for one more question. So up next, we'll go to Nick Popham with Como Radio. Go ahead, Nick.
Hi there. Thanks so much. Governor, I was wondering how you'd be able to convince folks who are a little more hesitant to download this app, or activate it if they have an iPhone. I know that obviously a lot of people with contact tracing, some were hesitant to answer the phone or be 100% on it. So I guess how do you convince folks to download this app, to be a part of this app or this program?
Well, I guess, just to share information with people, and people will make their own decisions on this. And I guess what I would do is, if someone expresses hesitancy, I'd ask them what the reason for that hesitancy is, and then just provide them the information that we can provide them. It's a simple app. It's elegant in maintaining privacy, individuality, voluntary decision making, anonymity, total lack of information as to where you have been. So I think a lot of the concerns, any concern that I can think of, have been answered in this regard. So the best I can do is provide information to people and let them make the voluntary decision. And as I've indicated, I don't think we've ever done anything that already had 200,000 people signed up. So a lot of folks do understand the benefit of this. This is in a sense, a non-governmental action here. This is a private activity between you and an algorithm that remains free of even maintaining private information. That's a pretty sweet deal.
Nick, did you want to ask a follow-up question?
Yeah, I did, if that was all right. I was just wondering why it took so long to get this going to where we're announcing it today as opposed to a few months ago. You mentioned a few other states or communities have already started using apps. Why did it take until the end of November for us to finally have an app for contact tracing that we can use here?
I thought you were going to ask why we're ahead of 46 other states. I may have misunderstood your question there. But.
So I think, for Washington, there were three things that were really important to us. One was privacy. The Apple-Google technology has been discussed for some time and certainly was a lot of buzz even before it was available. We were really clear that we wanted to examine the technology and bring together a group of folks who care about privacy, who know about security, and who are from affected communities. So we were intentional in putting together an advisory group who would review this. So that's number one. Secondly, we were very clear that we wanted to have this available to as many people as we could when it was launched, that it would be equitable. And that was the goal for us. And we, as the governor said, are releasing this in 29 languages, which is the most languages released so far. That was really important to us, that certain people essentially not have preference over other folks. And then we wanted to do a soft pilot, and we were really appreciative of the University of Washington engaging in this so that we could learn how this app gets rolled out, what we needed to learn about marketing the app, and make sure that we had our procedures tightly in place. So those three things all came about to say that, we did due diligence on behalf of the public, and we think the release right now, at a time when we're in a surge, is a good time to release this. People are paying attention, they're concerned, and we're appreciative of everybody's work who helped us get to this place.
Do you have any closing remarks?
Yeah, I think today's a good day in this ongoing effort, because it's another day where we have more power against this pandemic. And difficult as this pandemic has been, it is a situation we are not powerless. We have control of our own destiny. And today we have more tools to use. If people in the hospital community or clinics or pharmacies, if you can now sign up in the next few days to become enrolled, that's power. If people can use this WA Notify to help save themselves and others, that's power. If we can continue to reduce our exposures to social interactions that are not really necessary, that's power. We are becoming more powerful in this fight. And I ask folks to join this. You'll feel good about it. And saving lives is always a good thing. So thanks very much. Take care.